What say the Republicans, who have their own ideas for health care? Republican Congressman Peter Roskam hails from the president's, home state, adopted home state of Illinois, mine as well. He sits on the House Ways and Means Committee. Congressman Roskam was there at yesterday's summit. We should just point out, too, that George Miller, Democrat of California, was supposed to come on with us today. He said, unfortunately, he had to cancel just a few minutes ago. Congressman Roskam, what are you expecting to come from the White House and the Democrats? Are we looking at what's called reconciliation here? Will they try to pass it through without Republican support and without the 60 votes needed to overcome a filibuster?
Jane, I think that the approach yesterday was essentially a 6-hour seminar or infomercial, and the premise was that the president sort of thinks if only he can talk more about his bill, then the American public will sign up for it and have this aha moment. But I don't think what he realizes is that he is a skilled communicator. He has communicated through joint session speeches and town hall meetings and even Super Bowl preludes. The public understands what's in the bill, and they've rejected it. And I think the premise yesterday was, what's it going to take for Republicans to vote for this bill that Americans don't like? And we've said, let's start over and start with a clean sheet of paper.
They've been pretty clear, though. I mean, a fellow Illinoisan, Dick Durbin, senator from Illinois, this was his quote: "We can't just quit. This is a once-in-a-political lifetime opportunity. So if you're opposed to it, how do you fight back?"
Well, look, is this about the Democratic Party and their aspirations, or is this about the American people? The American people have clearly spoken over these past several months. They've spoken to me and many others in our districts. They've spoken in the elections in New Jersey and Virginia and Massachusetts. They do not want this bill. They were hopeful at the beginning. I gave the president credit. I said, look, it was more than a bumper sticker when you started talking about this, but the more people have listened, the more they've just shied away from this massive government takeover of health care, and the notion of taking on a sixth of the economy in the twinkling of an eye is something that the general public has said we don't want to see. We want incremental reforms where Republicans and Democrats come together, pass one bill at a time, and break this thing down. But it doesn't have to be this big monster bill.
But it doesn't look like that's what's going to be coming, is this piecemeal approach, potentially. So you go back in your district and they're going to be mad at you, too, for this gridlock and nothing passing.
No, my district is not mad at me. My district is saying stand up against this onslaught of massive spending and massive government takeover. And I think there is a real sense of clarity. Look, the only thing that there is bipartisan related to this bill is bipartisan opposition. Republicans are opposed to it on principle. Many Democrats are opposed to it. The public entrusted, Jane, this majority with a supermajority in both chambers. Remember, they got Al Franken. They got everything they need, but within their own party they can't come up with a program. So I think that it's, unfortunately, the president has made a decision, rather than fully engaging the minority party and saying, where are these common areas that we can work together? Instead, he's saying essentially, look, you're either on the bus or you're under the bus. And I think that's an unfortunate approach.
So how do you give hope to frustrated constituents back home then? I mean, as Senator Tom Harkin said yesterday, in this country, we are drowning in this issue financially. Healthcare, something has to change.
Oh, there's no question about it. And the irony is that the president pointed out, Jane, several areas where we agree. He talked about small business health plans, or allowing folks to pool together to negotiate a better deal vis-a-vis insurance companies. He gave some lip service to liability reform. Now, we're pretty far away from that, as you can imagine. He talked about allowing the purchasing of health insurance across state lines. All things that Republicans say are good ideas and can bring premiums down. But I think, unfortunately, the president and Speaker Pelosi and Senator Reid are saying we're willing to sprinkle some Republican ideas on the top of this, but we're not willing to negotiate and move one bill at a time. And what I'm hearing, and I think overwhelmingly members of Congress are hearing, that the public is actually not just disappointed and not just discouraged, but they're actually fearful of what they think may come as a result of this bill.
Congressman Peter Roskam of Illinois, and again, we had invited George Miller, Democrat of California. He couldn't make it. Hopefully he'll be here next time. Thanks to you, Congressman.
Thanks, Jane.